the IPL part of the platform. So I said, let there be light. So we're going to start first with what is IPL. IPL is Intense Pulse Light Therapy. It stands for Intense Pulse Light Therapy, not a laser. We treat it like a laser. We train as if it's a laser, but it's not actually a laser. It's high energy light waves are penetrated just below the skin surface and repair a plethora of problems for us. Damages the melanin that makes brown spots in our skin, and it damages the blood vessels that makes broken capillaries, but it's good damage because that damage will make that skin repair itself, and in the process, it produces more collagen and elastin, so that makes your skin look better. So it's also going to help fine lines and creases. So IPL is used to treat age spots, not necessarily melasma, and I don't know if you guys know the difference or if you've had any experience with melasma or have had friends with melasma. Brown spots, age spots, hyperpigmentation is more the spot that you'll get on your face, whereas melasma is something that sometimes you see whenever you have gone through a pregnancy or birth control or some kind of a hormonal change where you'll see sort of a brown splash across the face. There's a difference there. So if you had a question, we could talk after the presentation and just clarify things a little bit. But we wouldn't want to treat melasma with IPL because it can help it. It can do nothing, or it can actually make it spread more. So that's something that we would make sure of before we started treatment. Rosacea, this is wonderful for rosacea. Good to break down that red. Acne, great for treating acne. Broken vessels, as I said. It will shrink the pores, make the skin look tighter and healthier. And the fine wrinkles. It's not great for bigger creasing. For that, we have another treatment device on this machine that we would be using. But for just some general freshening the skin, this is a wonderful device to use. It tightens the skin. Pore size is pore size. If you have natural large pores, we're never probably going to make you be porcelain, but it will tighten the pores somewhat. IPL candidates are non-tanners because it's very important. As I mentioned, this machine will attack the brown and break down the melanin, as I said earlier. If you're tan, it's seeing a lot of brown, and so it's going to absorb more energy, and that could cause a burn. So we're very strict about you cannot be out in the sun for 2 weeks before we do this treatment, nor do we want you to be out in the sun afterwards because your skin's more vulnerable. So we would make sure that you're at a period of time where you're not coming from or going to a beach vacation or doing a lot of gardening or something like that. So this is a good time of the year to do something like this before you're out playing tennis again and doing all those outdoor activities. And that goes for spray tans and tanning beds as well, because all of those things will make the skin darker, so we don't want to take any chances with any of those. And it's not indicated for darker skin types. We have to be careful not to go higher than a skin type 4, which I don't know if anybody knows the skin typing, and you don't have to. We know that, and we'll make sure that we take good care of you and keep you safe. So what to expect during the treatment? We'll bring you in the room and give you the little sunglasses that you get, sort of like the ones of you that have done LED with us and wear the little goggles, only these don't have the little holes. They'll be totally occlusive because we want to take care of your eyes. Just make sure we don't shine any of that light into your eyes. We cleanse your skin because if you had any makeup on the skin that wasn't washed off properly, then that light that we're using might see that makeup, and of course it's darker and would absorb more energy, and that potentially could cause a burn. So we want to make sure that that skin's good and clean. We'll apply a little bit of ultrasound gel, and then we use the light. The light is pulsed against the skin. This is the device, and this is a sapphire crystal. It's the most expensive stone Sam's ever bought me right here. So when the machine's on, we just set this against the skin, and it gives a real bright flash of light. And you feel something that feels like a little rubber band popping, and it's not particularly painful. It feels like a little thump against the skin. And then it feels a little warm after we're done. Minimal discomfort is expected. It's like a mild snap, and really I don't find this to be particularly surprising like some things are. Depending on the size, takes a few minutes to an hour. I mean, we did Susie tonight before the presentation. Come up here, Susie, and let everybody take a look at you. Great, with no makeup on. Yeah, I mean, Susie came in with no makeup, and we did an IPL on her at 5 o'clock, 5:30. So you see how she's got a little bit of redness. but not really. She's just looks like she's been outside and taken a nice walk. She has some little brown spots that we're working on, and they turn darker brown, and they just sort of flake off over time. Same with the broken capillaries. Chris reacted a little bit more. We used a little bit higher setting with her, and she's got actually some redness. She was done before Susie, and you see her arms. She's got some little redness on her arms because we're working on some little brown spots there. So, and that should be gone probably by tomorrow, maybe the next day.
Feels like a little sunburn.
Feels like a little sunburn. We can put little ice packs on it if it's warm. But that's it. And sometimes you'll get a little bruising with it as well. But we can put some ice packs on if it's uncomfortable. The after effects, usually mild, resolve within a few hours to a few days. You see Susie looks basically normal again, where Chris is going to have some redness probably overnight. The dark spots, as I said, will turn darker, and that's what happens. The dark spots, they just get darker and darker, and they turn a little bit black, and then they just flake off. But it's really important to remember that you don't assist them in flaking off because you could cause some pigment issues with that. You just let them fall off. Small capillaries might appear a little bit larger before they fade. Sort of like any of you guys that we have done sclerotherapy before, those vessels will look a little more purple, and then they just fade away. You can have a little bruising because of the little thump of energy going into the skin. Minimal swelling. If you're particularly sensitive, sometimes you'll get a little puffiness overnight. Non-face areas take longer to heal. When Michael came in and we were doing some demonstrations with the machine and making sure this is the one we wanted to get, he did my arms. And my arms, the little brown spots lingered for probably a couple of weeks, and it took a while for all of those little brown dots to come off, but I was so excited when they did. It looked so great. You can get a little hyperpigmentation. That's something that we make sure that we do proper skin typing and choose the proper setting so we don't get hyperpigmentation issues. But if we do, something that we can work with. Occasionally, you could get some hypopigmentation. It's rare, and again, that's those of you that know us, safety is our #1 rule. We make sure that we will treat on the lower side if we have to, and give an extra treatment if that treatment didn't do anything to make sure that we are in the proper setting zone for you. But most all things that could happen in these settings that we're using will resolve themselves over time, over a couple of months. So we're making very sure to keep within safe ranges. Treatment schedule, we'll normally do 3 treatments in a series. Treatments are usually about 4 weeks apart, and I did this generalization. There's different parameters for different types of problems. We would narrow that down and customize that once we sit down and talk. Customize to your needs. And this is the Lumeka. I showed you the actual handpiece there. It works with a custom-built low-pressure xenon flash lamp, which basically means it's very safe, but actually a little bit more effective than some of the other devices out there. And we felt like this was a great and safe choice for you guys. So I'm going to introduce Mr. Michael Nufrio and let him come and tell you a little bit more about the machine.
So IPL was first invented back in 1995 by Mishka Krendel, the same person who is behind this company. So he knew how IPL worked for the last, 35 years. And also, he wanted to make it better. He wanted to make it more efficient. He wanted to make it powerful but safer. And what he's done with that is the Lumeka, and it is a low-pressure flash lamp, which means it's going to treat more effectively the browns and the reds in your skin tone that you want to get rid of. I was with Luminous for a long time, and that was where Mishka was before, and then he started this company, and that's where I went to. So that's why this IPL is probably, it's the most powerful, but it's also the safest one out there. And in Chrissy's hands, it's the safest product that you're going to have.
So I have a few before and after pictures. This is a décolleté after a series of 3 treatments. So you see how we can get rid of all of the age spots and ruddiness. You what? I knew that patient. Yeah, you were there. Were you there for the treatment, or you knew the patient? Yeah. And this was 1 or 3? 1 treatment. 1 treatment. And there you can see quite a bit of skin rejuvenation. Helps with the brown spots. Okay, now here is Peggy. This was before on her right arm, and this was after she had done 2 treatments. Okay, and this is her before on her left arm, and this is after she had done her 3 treatments. Now I have her strip. And only if you work in the skincare business are you going to be crazy enough to do this to yourself. This is like doing one side of Botox and leaving the other one straight. But I said, Peggy, would you do a little strip for me so I can show everybody? And she was going to be here tonight. Her grandson had an event she wanted to go to. But you can see exactly where she treated one time, one treatment. And I have another shot of that. So you can see exactly where she did her strip for me. Isn't that? Because it does not matter what the lighting, you see exactly where it is. What we are able to do on this machine now is not only the Lumeka we're talking about tonight, we also can do the body effects, which let me tell you, I'm personally excited. I have trimmed my flabby belly down by a little bit and have a lot of people excited about that. And we're also doing Fractura, which is the collagen induction therapy, the microneedling, but it also adds the radio frequency beneath the skin, and that is amazing. The tightening and lifting that we're seeing with that has been amazing.